welcome everybody. We have over 200 people registered for this webinar. And what we'd like to do is to just take a quick poll to actually see who is on the call right now. So you should see a poll show up on your screen. And please indicate, are you an academic, a practitioner, a policymaker, etc. And let's get a sense of who's actually on the call today, and that will help me identify the kinds of examples I should be using throughout the webinar. So it looks like we have a nice mix of mostly practitioners, but also a nice mix of policymakers and academics as well as some people that are other. It'd be interesting to know who you are. So certainly type that into your chat box if you would like to. So welcome everybody. I'm thrilled to be here today to talk to you about what we've learned about how to promote systems change within communities. Before we get started, I actually want to go through a couple of housekeeping rules here. So first, I want to share with you some ways to participate here. You'll note that there's a chat box on the left-hand side. You're going to actually have an opportunity to post some questions and comments to us throughout the day. And throughout the day, I will be identifying some of those questions and providing answers to you. So please, at any time throughout this webinar, post your questions that you have in that chat box area, so we can make sure that we take care of any concerns that you have and that we're making this as meaningful for you as possible. In addition, if you have trouble hearing, please note that you can call in via your phone, and here's the information for that. If you have your smartphone with you, you might want to take a picture of this in case these issues emerge at any time. So today I'm going to be talking primarily about what does a high-performing community change initiative really look like, and what are the habits of high-performing community initiatives. And because I think language is really important, I want to make sure we're all on the same page what I mean by this term high-performing. Sometimes we might think about something like this. Though lovely, that's actually my daughter in the white there. What I'm talking most specifically about today is performing to actually achieve targeted outcomes. And in particular, I'm going to be paying attention to the kinds of outcomes that are related to conditions for children, youth, and families. And the reality is that there are lots of problems that children, youth, and families are currently experiencing. Large number of kids under 18 living in poverty, large number of children dropping out of high school, kids entering school not ready to learn, large numbers of adults and children who are obese, overweight. Here are some actual statistics from one community we've worked with in the United States. So there are lots of problems that we need to be focused on. And when I say high performing, I mean that you are a community that has zoned in and targeted an actual problem like this that you want to focus on at the population level, and you are engaging in systems change to address that problem. What we know, though, unfortunately from the field, is that even though we are putting a lot of different strategies and solutions into communities, many solutions that we put in the communities don't work. And I just want to highlight quickly why that is, because that's sort of the backbone for the framework that I'm going to be introducing to you today. One of the main reasons why many of our solutions don't work in communities is because how we address and think about change. Our most typical approach to change in communities is to approach it like the following. We see a problem or a goal that we have. We want kids to be ready for school because a lot of kids are not. They're not coming in literacy ready, for example. And we put into the community several different programs or interventions. Maybe a parenting program, maybe more preschool program. Maybe we offer professional development for teachers. And we populate our communities with these programs. The problem is that this approach to change is insufficient because the problems in our community don't look like this. They actually look like this. What is causing any problem that we focus on, children not ready for school, children living in poverty, children being obese, for example, is the result of all of these different community conditions, what I'll refer to as the orange boxes, working in interaction together to cause that problem. And that is the result of community problems actually being complex. And what I'd like to do is make that really practical for you and give you an actual illustration of this. And so in the state of Michigan, where I'm from, we actually had a huge policy win around getting kids ready for school. and that is that advocates were able to get our governor to increase the number of slots within the state that were funded by state tax dollars to low-income kids to be part of pre-K, and that's pre-kindergarten programming. We added 16,000 slots. However, what we discovered is that even though there were hundreds of thousands of kids on the waiting list to use those slots, in most communities they were only able to fill less than 50% of those slots. So a community could have received 1,000 new preschool slots, and maybe they were only able to fill 25 to 200 of those slots, for example. And we worked with those communities in Michigan to find out why. And here's some of the stories and some of the data that we learned. In some communities, it was very common for the parents to not understand the value of preschool, so they chose not to apply. In many communities, those slots were half-day slots, only in the morning or the afternoon, and for low-income families, who were the ones who could only use these slots, that did not work for the kind of transportation and jobs that they had. Pediatricians were not told about these slots, and in many communities, they are the most reliable and trusted resource, particularly to children who are 0 to 5. Local organizations that had wait lists for their own pre-K programs weren't sharing those wait lists with the state-funded organizations. There was no transportation to many of the locations where these slots and programs were offered, and nobody bothered to ask the parents themselves how and where to design these pre-K programs to make them the most usable for them. This is just one of many examples of how we put solutions into a community without paying attention to all the various factors that could influence their success. And that's because the kinds of problems that we're dealing with are actually very wicked. And if we have wicked problems, we actually need to come to them as with wicked solutions. And so what I want to share with you today is how we can actually help communities think in ways that allow them to address this kind of complexity. And that would involve 3 critical things. They need to pay attention to the system and make the system, those orange boxes, the actual focus of their work. Number 2, they need to act immediately because children and families need solutions today, not 1 year after a strategic planning or community planning process. So we need to help communities learn how to act immediately, and when they act, they need to do it effectively. And finally, we need to help communities adopt a learning process so that they're acting and learning and adapting as they go. These 3 elements of high-performing community initiatives are essential for ensuring that we actually can achieve those targeted outcomes that we want. But we also know from the work that we've done and others across the world is that addressing and developing this new way of working is going to require us saying goodbye to our old habits of how we do work and adopting some new habits. So what I want to share with you today are those 4 critical habits that you need to be developing and adopting in order to help your community move into a high-performing community initiative. I'm going to provide you with some examples from the field for how other settings have started to adopt these habits. And I'm going to introduce you to several tools that are part of the ABLE Tool framework. You will have access to all of these tools on our website, and you will get a guide to which tools to access for different parts of our model after the webinar. So what I'd like to do is get started by talking about what those habits are of a high-performing community initiative. And what I'd like everybody to do, if you could work with me, it's not so easy to do this via webinar, but watch me for a minute. I want you to take your pen, grab a pen in your hand, and what I'd like you to do is position your pen in front of you so it's vertical like this, and raise it. You're not going to see me do this, but I have it raised all the way. My arm is stretched completely above my head, and I'm looking at the bottom of my pen. And now what I want you to do is to draw a large clockwise circle on the ceiling with your pen, keeping it upright. Keep it large and above your head. Watch and see that big clockwise circle. And now, keeping that circle going, don't stop drawing that circle. Slowly lower that pen down below your waist belt, and now look at the top of your pen, and what do you see? Please type in to the chat box, what did you see as you went from watching the pen on top, big clockwise circle that you're drawing, and as you bring it down, below your waist belt, you're looking at the bottom the top of your pen now, what's different in the way that that pen is moving? Does anybody see any difference? Some people are getting dizzy. Yes, the circle can get smaller. What you should have also noticed is that when you were looking at the pen above you and you were drawing it clockwise, even though you did not shift the movement of the pen, when it got below your waist belt and you looked at the top of the pen at that point, it should be moving counterclockwise. And so that is not because you shifted how your pen is moving, but in fact what shifted was your perspective on that pen. So let's talk for a little bit about that, okay? I like to think about the analogy of the blind men in the jungle that come across the elephant, and that depending upon which part of the elephant the blind man touched, they came to a different conclusion about what was on their, in their way along that path. If they touched the ear, they thought it was a leaf. If they touched a leg, they thought it was the trunk of a tree. If they touched the tail, they thought it was a snake. And so this is, they thought it was a rope. If they touched the trunk, they thought it was a snake. And to me, this is exactly analogous to and similar to that pen. Depending upon your perspective, that same phenomenon will draw and cause you to come to a very different conclusion because of how you see it given where you're positioned. And this brings us to habit number 1, that effective, high-performing community initiatives are engaging the critical perspectives in defining and addressing the targeted problems. And by that, I don't just mean bringing lots of people and diverse people around a table. That's actually something we've been doing since the 80s. What I'm talking about is being very systematic in identifying who do we need to engage, because they're going to be seeing and understanding the complexity of our problem from a different perspective because of where they're situated in the community and in their role in their lives. Depending upon who you are, where you live, what role you have in a community, you will see a different set of those orange boxes. What effective community change agents do is they identify systematically who those perspectives are and who they need to engage so that they can understand all of the orange boxes that are affecting their targeted problem. When we don't do that, we actually create, frankly, some dangerous solutions that in implementation can create more harm than good for community members because we don't take those diverse perspectives into consideration. And believe it or not, this is an actual path that was created in Florida, because nobody bothered to ask the residents whether or not this was a place for hikers and bikers. And so what does it mean to actually be systematically thinking about those different perspectives? In our work, we provide communities with a framework of 4 different perspectives they always should be considering. Number 1, and most important, are those individuals experiencing the problem, the children, youth, families, and adults who are experiencing the actual targeted problem of your initiative. The second most important group are those individuals on the front lines providing direct services and supports to the people who are experiencing those problems. So these are the teachers, the healthcare providers, the home visiting nurses, the police officers, those individuals touching people daily in the trenches, helping them address the issues that they're struggling with. Third are the individuals who are more part of that natural support network that matter in communities, and this includes the faith-based institutions, etc. And finally, those individuals who we tend to consider most of all, and those are the individuals deciding on the changes and the resources that need to be used. Those are the leaders. And so what we've discovered is that by helping people think about those 4 groups in a very intentional way, we can help them expand their boundaries around who they include in understanding local problems, designing solutions, taking action, and learning and improving. In other words, the expanding of perspectives needs to happen across all phases of the work. So let me provide one example from the field. And one of the things that's very common in the United States is that when we ask people to identify who do they typically engage in their work in this kind of way, they almost never engage those experiencing the problem. They almost never engage the natural supports. They sometimes engage the people who are providing direct services. And in fact, it's the greens, the people who are providing and making all the decisions and providing resources that tend to control what problems are targeted, what solutions are designed, and what learning happens. So to help communities themselves see this pattern and recognize the need to shift it, we engage them in the following exercise that's very easy for you to implement at home in your own communities. We give them a piece of flip chart paper that has these blue lines on it, and we give them 4 sets of Post-it notes that are color-coded to go with our 4 stakeholder groups. And we first ask them as a group of community members to identify the perspectives that to them in the ideal world should be engaged to see their whole elephant, the problem they're targeting. And they list all of those and they put them in that top quadrant. We then ask them to then we introduce them to other ways to think about different kinds of stakeholders. For example, we introduce them to the importance of paying attention to diversity. It's not uncommon for people to just say, for example, that families should be engaged without actually identifying that families themselves are very diverse. And we have them then add to the bottom quadrant here all those additional perspectives that they should be thinking about once we give them some different ways to think about perspectives. And then finally, we ask them to now, on the left-hand column, move over there all of those stakeholders that are actually currently involved in whatever stage of the work we want to be talking about. Here we said prioritizing and understanding. We have them pause and look at what are the colors that are on the left-hand side versus the right-hand side. And what almost always happens is that on the left-hand side, I have a lot of greens, because in my community, I'm engaging those deciders and decision makers a lot. And the pinks, the people that are actually experiencing the problem, are rarely brought over to the left-hand side. We have found this to be a very powerful and inexpensive tool to use and quick tool to get communities to realize that, hey, we need to start to engage those families. And we then introduce them to various methods for how to actually engage those communities and in the families in their communities. So what I'd like to know from your own experience, and you're going to have a poll come out now as well, is that as you think about your own work in communities, who is most often not involved in identifying, defining, and prioritizing local problems? If you could answer that, think about a community that you work in, or perhaps what you've read if you haven't directly worked with a community or you've observed. Who is most often not involved in identifying and defining local problems? Well, so it's looking like we have a lot of communities or participants that are saying that it's, again, those experiencing the problem that are the least likely to be engaged. And as the second most popular area is those providing informal supports. That's very common to what we've seen in the hundreds of communities that we've worked with as all. So we're going to close that poll. Thank you for participating. And what I want to do is sort of introduce you to some methods that you can be using to start to engage those different individuals. And you're going to hear several different methods as we go throughout the day. I would say that one of the areas that myself and my partner, Erin Watson, who co-created ABLE with me, is most proud of is the fact that we are very successful at helping communities engage those constituents, those pinks, very effectively in their work. So let me share one story about that. This is in Saginaw, Michigan. That's my home state. And Saginaw, when we started to work with them in 2007, was identified as the 5th most violent city per capita in the United States. It was not a great place to live. It had high levels of poverty, substance abuse, etc., and high school dropout rates. We were brought in because they had a large number of youth who were ending up in psychiatric hospitals, detention centers, out-of-home placements, and on the streets because their social emotional needs were not being taken care of. And one of the main reasons why was because very few youth were taking advantage, and their families, of the various programs and supports that were out there in the community. So one of the things that we did was we worked with them to identify, using that exercise we just showed you, who should be engaged in understanding that problem. And we identified 3 key groups that are often not involved. One was youth themselves, the families who had youth with social emotional problems, and a variety of direct care providers who worked with these kids and their families. So we went out and had conversations with those groups, And let me share with you what we learned, and what we were struck by ourselves was how diverse their perspectives were on why youth were not engaged in programs. We talked to providers. They said things like, oh, parents and youth don't just know about the program, so we just have to send some flyers out. Parents, they don't follow through. Youth, they don't want to go to programs. And of course, they identified that there were not enough slots out there. Meanwhile, when we got to youth, they told us that they had been involved with the programs, but the providers were very blaming and interacted negatively with them, so they didn't want to be involved in anything else. And that the programs that were offered didn't meet their needs, which offered and suggested different solutions. And finally, the families themselves. They also identified that the interactions they had with providers were negative and they had no desire to be engaged again. They also talked about how the intake processes were too cumbersome and they didn't have time and they couldn't take time away from their jobs, and the programs weren't offered in convenient places. And so as a result of this, we realized that there were different perspectives, and we came up with many different solutions in response to these perspectives. You can see those on the slide at the moment. So I'm hoping that you're seeing that the value of engaging these different perspectives is that it really helps you to identify different ways that you need to be understanding the problem, different factors causing the problem, because those different factors require different solutions. Okay. One other way that's very powerful that we've used to engage families and youth and adults in our work is through Photovoice. Photovoice is a method that was developed by Carolyn Wong at the University of Michigan, and we've used it quite a few times in many communities around the United States. We train people in how to use Photovoice, and we get them interested in it by simply doing the following in one of our workshops. We ask people to take their smartphones, to go outside, and to take a picture to answer the following question. What are your dreams for your children and families? They're then asked to come back into the room, to find two other people in the room, and to talk about their photos. That is exactly what Photovoice is. You give people framing questions, and they go out into the world and take pictures to answer those questions and then share their stories about those pictures. I'll show you one case example from one of the projects we did with youth. This was in response to the question, what are my dreams for my future? And this was taken by a young man who was 14 years old, this photo. So look at this photo and ask yourself, what might he be trying to tell the world with this photo? What is the story he's telling people about his dreams? I'm going to read to you the story that he shared with us. What is most important for people to understand about this photo is that if I have a kid, I want to be there for them. I don't want to be the one. I don't want my kids to be the ones that don't know their father. The photo also tells young people that they should watch what they are doing, because always younger people are always looking up to them, like my little sister is looking up to me on the stairs. Also, if I want to have a family, I shouldn't do drugs or nothing. If I go to jail, my kids wouldn't know me. This is a young man who's 14 who was a gang member himself. His father was in jail for life for murdering a rival gang member, and his mother died of a substance abuse overdose. He is also an individual that had dropped out of high school, and through the Photovoice project started to believe that he actually had value and voices, is what he shared, and re-enrolled in high school, and I'm happy to say is now in college. And so this to me is a powerful example of what can happen when you actually give people an opportunity to share their voice. The youth in this project also got involved in making change related to the issues that they identified in their community. When you do Photovoice projects, you create exhibits. Those exhibits can be roving and travel to lots of places in the community for people to see and tell their story. On our website is a whole guidebook you can use to help you learn how to use Photovoice. It is a very powerful way to help to bring into the conversation the issues and concerns of your very targeted participants, and it has the great benefit of helping those participants themselves to see a voice that they have in the community that they hadn't had recognized before. So just to wrap this up around high-performing partnerships, high-performing partnerships design around diverse perspectives, they engage diverse actors in change efforts, and they involve their constituents as change agents themselves. So what I'd like to do is open this up for questions to see if anybody has any particular questions or comments about Habit 1, engaging critical perspectives, and defining and addressing targeted problems. So, yes, so we can take 2 questions here. So if you have a question you would like me to try to answer in the time, please send that in now. If you don't have anything now, what you can do is you can still submit those, and our facilitator will send them my way. But you can also send them after the webinar, and you will receive some instructions for how to do that, and we will try to answer them then as well. Yes, and so the cross-cultural aspects of Habit 1, I think that's an excellent question. So one of the things that I noted is that one of the things that we do after we have people initially identify their perspectives is we actually ask them to think about the diversity within their community along multiple dimensions, and to identify the degree to which that diversity is engaged and has been engaged in the past, and the factors that will often get in the way of that lack of engagement. So one way is to be paying attention to the different cultures that exist within your community. The second is to also begin to ask the question, for those different cultures and the different groups that we want to engage, what are the ways of engagement that we need to be using to effectively engage those different cultures? One of the things that we do is that we really spend time talking to the different cultures in a community to understand the best way to engage them. So, for example, one of the communities we work with in the United States has one of the largest refugee communities in the world. They have over 120 languages spoken in the public school system. And so when we were trying to organize and identify how to engage families, we met with different cultures to try to address how to do that. So Photovoice is not the only avenue for engaging these individuals. There are many different kinds of projects that you could be engaging in this process. If you go to our website, we have an entire set of methods and processes for engaging different groups within this process. And I'd be happy to help direct people to some of those tools after the webinar. What I'd like to do is I'm going to move on to the next habit just so we can make sure that we get through all 4 during this webinar time. But keep submitting your questions so we know what they are. Okay, so habit number 2 is that we have to make the work about understanding and changing the system. And so that means we're really trying to understand what those orange boxes are, and that we want to make the work about the system across all stages of the work. And what I want to do is start by talking about how to make it about the work when we're trying to understand those local problems and conditions and creating a vision for change. So remember, community problems look like this, right? And so what I want you to be thinking about is I'm going to describe a scenario for you, and I want you to ask yourself, how often have I been in a meeting and I've observed the same thing happen? Somebody comes into the meeting because they just saw some data, and they announce a problem such as, gosh guys, I just saw the kids count report, and not all youth have the social emotional wellness needed to thrive in school, home, and communities. We have to do something about that. And then some other person who's very eager and motivated to make change happen jumps in and says, I know what we have to do. The problem is that that's occurring because youth have undiagnosed mental health problems. Let's start a campaign to inform parents about what to look for and where to go for services. Everybody in the room says, great idea, and off they go implementing that solution. So an initial problem statement followed by a quick solution that people get behind, and off they go. It may not seem so bad. This seems to be a program or a group that wants to move to action. But let's diagnose that a little bit closer. What happened there? That person heard the problem, but then they jumped to some solution as to why that problem was occurring. They made the assumption that some parents don't know what to look for and where to go for services, so they want to implement a campaign to educate parents. The problem is there could be other reasons why youth have undiagnosed and untreated mental health problems. Maybe there's no mental health screening available to most youth, and that's because the screening isn't occurring in settings where youth go. Or maybe youth can't access the mental health services in the community because they aren't eligible through income restrictions to the programs that are out there. And that would require expanding the eligibility options that are the programs follow. Or it could be that the school personnel don't have the knowledge to identify these problems, and we need to do some professional development with them. So note, depending upon the reason why youth are having those undiagnosed problems, leads to a very different solution scenario. The challenge is that too often in communities, people only think about one of these paths. They don't pay attention or even acknowledge that there could be other reasons why. And as a result, our solutions are ineffective because it could be that it is a combination of all of these reasons that are creating the challenge of youth having undiagnosed mental health problems. What I'm talking about is the importance of doing root cause analysis. And within the systems world, this is a key and core practice to thinking systemically. And what that involves is instead of focusing only on the initial explanation of a problem, we are paying attention to those deep root causes. And it's a pretty simple process. If you know any 3-year-old and have spent some time with a 3-year-old, you know how to do it. You simply ask the question why. You have your problem. You ask yourself, why is this happening? You generate that initial set of causes, and then you say to yourself, well, why are those things happening? And then why is that happening here? In all of our work with communities, we spend time teaching people and giving them practice conducting root cause analysis. And let me show you how to do it again. This is a very simple thing to do. We provide them with a flip chart and some post-it notes. We have them write their problem at the top, and then in small groups of people, say 5 people, for example, we have them first identify why is that problem happening in your community, and they're able to generate as many reasons why as they can come up with, but they need to be reasons they have personal knowledge about, they've experienced, they've seen it happen within their community. We then have them identify across those reasons, pick 3 or 4 that they think are the most important to target in their community because they're feasible, things that can be shifted, and they're powerful. If they shift them, they'll make a real difference. And then for each one of those prioritized reasons, they go down to the next layer below, and they identify the next layer of reasons why. You'll note that sometimes you have to go down even another layer. You're looking to get very specific and actionable causes that individuals can begin to address in order to get to that targeted problem. And then those final root causes that they prioritize at the very bottom later are then what they design their strategies around. And the work that we've done, at least in the United States, learning how to do root cause analysis has been very transformative for most of our communities, and it becomes a practice that they embed in lots of their settings, not just in the work that's related to the community initiative. Here's one example of a community that did this. They again flip chart paper and sticky notes, a very simple tool for making this a reality. So what I'd like you to do, let's practice this. I want you to think about the problem of adults and children being overweight or obese here in Australia. Think about that problem. And what I want you to answer in the chat box is what is one root cause or reason why this problem exists within the communities you work or live. Again, this should be a root cause that you have knowledge about, you've experienced, you've observed. So please write some root causes, and then we'll share what some people came up with. Let's just take a minute to do that.
Not meeting physical activity guidelines. Unhealthy food environments.
So having an unhealthy food environment.
Sedentary habits.
Having habits for being sedentary, not being engaged in healthy, active lifestyles.
Expensive food.
Food too expensive, not accessible, not affordable. Income inequality, right. So these are great. And so these are great examples, and note how each one of those root causes would require a different kind of solution, and that it is often true in communities that you actually need to be answering and addressing multiple root causes to address the problem, again, because there are multiple causes to any problem within our communities. Another tool that we train communities in addition to root cause analysis, is to conduct a more systematic investigation of those orange boxes, and we call that conducting a system scan. And a system scan explores how your local system or community characteristics are either in alignment or out of alignment with each other and your goals. All of the communities that partner with us, that we work with, conduct a system scan. It's a core part of our process. And we actually have people conduct that system scan across 6 different system characteristics. These are generated from the literature as being key root causes to community problems. They involve understanding local mindsets, attitudes that people have about the problem, about each other, about the targeted population, about the service system. Components refers to the array of programs and supports that you have available. Is that array culturally competent? Are there enough slots? Are they accessible and affordable for people, the programs that are out there? And are they reaching the targeted population? Connections refers to all the ways that people in the community are connected to each other and what flows through those connections, such as how are resources flowing? How is information being shared? To what extent are people co-locating different programs and supports? There are also regulations that are critical. Regulations refer to the policies and procedures that guide day-to-day life. Many people view that the regulations that come from this federal system and national system is the most important set of policies. However, what there is emerging research is to suggest that it's actually the local regulatory environment that is equally important to be paying attention to. Resources refers to not only the money, but also the capacities that are in place within the community for people to live good lives and to do the work you need them to do. So do families and providers have the knowledge and skills to implement and to shift the kinds of behaviors we're asking them to do? And do communities have the living supports to support good life, jobs, housing, transportation networks? And finally, power. Who has voice? Who doesn't? And what are the implications of that for solving the problems in your targeted community? So we have designed a set of questions around those 6 system characteristics. And those questions are both general as well as related to some specific common community issues that many people in communities face. So for example, in our work, we've learned that some of the common community challenges are things like accessibility. People can't get to the programs and supports that are out there. The quality of what is out there is not high enough to actually solve the problem. Efforts across organizations are not coordinated. The system doesn't understand family youth needs and isn't responsive to them. The services and supports are not in alignment with each other and often conflict with each other. Families are not engaged actively in supporting the work, and there's a lot of inequities in outcomes. And our system scan process is set up to both provide you with general questions as well as questions around these particular kinds of issues. And so what I'd like you to do for a minute is think about the communities you've worked in or are knowledgeable about, or your own community, and which system issue most commonly gets in the way of your community change efforts. Just pick one, and if the poll is going to go live now. So what's the one issue? If you were to do a system scan today and could only pick one issue, which issue would you focus on in your system scan? So it seems like we have lots of people who are identifying sort of the top 3, which are coordination of efforts, accessibility, as well as family engagement. And I will say those are 3 of the most common ones that often come up also in the United States. So I'm going to close that poll for now. And what I want you to know is that you have available a resource that's called the System Scan Question Guide. And if you go into the System Scan Question Guide, which we are going to send to you after the webinar, you will see that in the left-hand column the different system issues will be identified. So imagine where it says general exploratory questions, it said instead accessibility of services and resources. And if that's the issue you prioritized, then we have placed there questions around the 6 system characteristics that you could go into your community to begin to ask to understand that system issue well. And these are questions that we've developed on our own. we've taken from the literature, and also as we work with the hundreds of communities around the country and they come up with great questions themselves, we add them to this guide. So that's a resource that you have available to you. Let me give you some examples of this. So for those of you who thought about accessibility, here are some questions that one community asked. They were focused on the accessibility of programs for youth and families to support the social emotional needs. So they went out into the community and they asked questions like, how accessible are local programs for the most vulnerable youth and families? What gets in the way of families accessing local services? Which programs are the hardest for them to access? And then to get even more specific, to what extent are local programs offered at times that work for low-income families? And so then this information comes in and then informs the actual change projects that you start to do, and I'm going to be describing that to you in a minute. So when you're doing your system scan, a critical question that it might be in your mind is, well, who do we go and talk to? So remember our categories in our elephant. We use the same categories here to help us identify who to engage. And we have a very systematic way where, given the questions that we want to ask and answer, we then think very specifically about who we need to talk to in the community using these categories. And we use we have a system scan design guide, which is another tool that you will have access to after the webinar to help you go through and identify the ways to actually design the system scan. What I want to share with you are some of the methods that we've worked with communities to develop, very feasible methods and powerful methods to have them do this system scan. For me, what was really important was that we designed methods that communities themselves could conduct, and that these methods themselves would actually be interventions, because they would provide opportunities for conversations and awareness that didn't typically happen in those communities. And so I'm going to give you one example. In Michigan, we work in every county. Every county has a collaborative that is focused on promoting school readiness. And these counties had to quickly gather information from a bunch of different perspectives, and they already had monthly collaborative meetings that we could leverage as a way to gather this information. So what we had them do was identify a broader set of stakeholders using our system scan guide and design guide. They identified who all they would need to have engaged in their system scan. So their collaborative meeting that may have only involved 20 people, they got 75 people to come to that meeting. And in that meeting, we did what we called our hybrid method. We had people organized into tables around affinity groups. So all the parents were at a table, all the funders were at a table, all of the healthcare providers were at a table. We did that so people could feel that they could talk openly and honestly about their experiences with the system. And then they received a system scan worksheet. They had 7 minutes to answer the question for each system characteristic. So let's say we talked about mindsets. We would have maybe 2 questions about mindsets. Everybody would write their own answers on their own sheet, and then they would have 7 minutes to share and to prioritize as a table. We've done this method with hundreds of communities. That's 7 minutes and 5 process works, right, for the debrief. And this is an example of what that system scan worksheet looks like. Again, this is also on our website. This is our most popular method and is an incredibly quick way to get a lot of specific data about your system in 2.5 hours. These counties, some of them had data from 60 to 80 different stakeholders and providers. And then they use this data to identify key targets for change within their community by engaging their collaborative and other stakeholders. If you don't have time to do something like that, we do what we call a small dose approach, where people take 1 or 2 system characteristics at a time and they just integrate them into existing agendas, not only their own, but other groups across the community where they need to understand their perspectives. We also leverage direct touches a lot. We identify in the community who's touching these families or children or youth on a regular basis, and we could ask them to maybe add 1 or 2 questions into all of their conversations, or we actually give them a survey. One of the popular methods that has emerged because it was created by a local community member and it's traveling around the United States quite a bit is what we've called the Fast 5 survey. It's a set of questions that a direct touch can provide to families or to children and youth that can be completed in 5 minutes during their visit. So a case manager might get this, a school social worker might have the Fast 5 survey, a home visitation work. It's a great way to get a lot of data fast from diverse sectors and community organizations and communities. So what I'd like you to do is let's put your answers into your chat box. I want you to think about your targeted problem or goal for your own community work. Are there any natural touches that you might be able to engage or you might want to engage to ask your targeted constituents some questions? So if you were to do a Fast 5 survey, who might you ask to take that Fast 5 survey live? So if you could just type your answers in. If you could just type those in, and then our facilitator is going to read those out loud.
Guidance officers, community health workers, midwives, teachers, social and welfare agencies, school student leaders, church leaders, local government, retail food outlets, council health promotion officers, midwives.
That's great. That's an excellent list. This is another, I would say, our second most popular approach for gathering data is to leverage those direct touches, either by having them ask open-ended questions or to do a Fast 5 survey. Community members are always shocked that local organizations and providers are willing to do this. It is rare for our communities that partner with us to get a no to that request, because the promise back is that you'll find out what we learned. And it also is a great way to bring those direct touches into your work because they're now seeing the value of the work that you're doing. Okay. Another feasible, inexpensive way to collect data is to put questions on existing forms and applications. So think about all the intake forms that families and children and youth fill out in order to get access to our services. We actually have communities use those as ways to gather information and to bring them into their community. Kindergarten applications, every single family of a 5-year-old in the United States has to fill that form out. We're starting to get communities to make that as a way to gather yearly information about those 5-year-olds coming into their community to inform their community change work. We also do a larger family survey that I would say is a little bit more like what researchers and evaluators might use, but we actually have communities do it. We have them work with diverse sectors and actors and partners together to design a survey that multiple agencies and sectors would support. And so, for example, in one community in Michigan, we actually had 17 different agencies representing education, healthcare, economic development, and childcare go out into the community and agree to do this survey. Surveys were collected from over 500 families in a 1-month period. Every organization got to have questions in that survey that was relevant to them, but there was also a shared set of questions that were asked about everybody. And again, the organizations were incredibly shocked. The organization that sponsored this was shocked that all of these other agencies would be so willing to engage in such a collaborative effort. What is most important to do in all this work is to make sure that you're paying attention to the potential inequities in your communities. And the only way you can do that is if you ask demographic questions so you can disaggregate data. One of our sort of guidelines, if you want to be an able partner and work with us, we require that you ask these demographic questions. Obviously, we do it in ways that is culturally sensitive to every community, but it is the only way to identify the inequities and to illuminate what has to be shifted. So in that community that I just shared with you, where we collected data from families across all these different agencies, we actually asked families if they saw, to what extent did they see doctors and medical professionals as a source of information for what to expect from children developmentally. And note the big disparities across the different racial groups and ethnic groups within this community. This finding was huge for the local medical professionals who had no awareness that the African American, Hispanic, and Asian population was not trusting them. And they began to do some cultural competency training after they held focus groups with those populations and learned that the practitioners were not using culturally competent practices with them, which was why they stopped listening to those providers. So what I want to share with you is some of the outcomes from doing a system scan. Not only can the system scan produce the data that you need to identify what you need to target about your system, but it can also do some important shifts in impacts on your communities. So it helps you expand your work and identify system issues. So for example, one of the things that we do is that system scan data, local communities make sense of it. We train them in how to do that. They go through a prioritization process to identify what they should prioritize for change, and then those priorities get embedded into their local meeting agendas. So what I've inserted here in red on this slide is an example of one actual community. This is what they prioritize from their system scan, and they began to identify ways in their local meetings to address this issue. In addition, and I think this is probably even more important, what we've discovered is that the system scan promotes engagement of critical stakeholders and a critical consciousness in ways that we honestly did not expect when we launched this methodology. We've had, in most communities, new partners who were not part of the work start to become engaged and offer a commitment in a deeper way than they had before. There is an awareness of system issues that didn't exist before, and there's a buy-in for the strategy design. So for example, we've had critical organizations join initiatives and share information and processes. They have been unwilling to do that. We've had funders make the targeted issue a priority, and so more resources are available that were there before. And we've had school districts and other organizations committed to making change and actually start to work on things that the local community had tried to make happen for years. And so immediate shifts in stakeholders' willingness and readiness to participate, which I think is really important for initiatives like this to build. And so what I'd like to do is let's open this up for questions around Habit 2. How can we make the work about the system around defining the problem? I just shared with you root cause analysis and the system scan approach. What questions or comments do you have that you would like to put into the chat box, and our facilitator is going to read those aloud for us. And while we're waiting for those questions to come in, I just want to reiterate that our website has hundreds of tools on it. That website was designed for the people who receive our 6-day training. It might be a little overwhelming for you to navigate on your own, and so I'm in the process of creating kind of a cheat sheet for you that will be identifying the critical tools you can go to look at given the content of today's webinar, and you should be getting that cheat sheet sometime next week.
So one of the first questions asks, should there be a step before this to understand the assets that are in your system first, so you know what you have to work with?
Yep, that's a great question. And so in many of the communities that we work with, those assets have already been identified, and so I should have mentioned that before. The asset strengths-based approach is really dominant in the United States. So many communities already have that. And in addition, one of the things that I didn't mention is that in the system scan, remember, you're looking at things that are aligned as well as not in alignment, and those alignment questions are around identifying local assets to leverage. So in the typical system scan, you are generating both local assets as well as local problems.
And Lori asks, do you define the boundaries of the system?
Oh, yes, so we do. I just didn't spend the time on that today. That's actually a very important part of our stakeholder process at the very beginning when we have people identify the perspectives. So we actually have several tools. I'll make sure that I include that in our cheat sheet for you. Boundary definitions are really a critical part in helping people understand that the boundary has to be drawn, but in reality that boundary is actually pretty arbitrary and the consequences of that.
And this is a good question. Is there a need to upskill first to avoid solutions that don't include the unknown? This can be a risk.
So I need to hear that one more time.
Yeah. Mm-hmm. Is there a need to upskill first to avoid solutions that don't include the unknown? So I imagine what Lori might be referring to there is I'm guessing, the things that we try and anticipate as unintended consequences. How do we do we need to build skills first in order to appreciate that there is the unknown, and how do we work that into some of our responses in dealing with these contexts?
That's right. So, that's another great question. I think one of the challenges here in this webinar is there's a lot of background training that's happening around our model that I'm not able to go into. Certainly, one of the things that we do in our first half day of training is we help people understand the complexity of the system. And one of our mantras is the system is the gift that keeps on giving. We give lots of examples of the kinds of unintended consequences that can emerge in this kind of work. And we help people develop the infrastructures from the get-go to be able to track the kinds of consequences that can emerge, both positive as well as negative, as a result of this work. I also do believe that one of the big tensions in systems work is the recognition that there will never be enough capacity locally, because capacity is fleeting. People come and go all the time in these systems. And so our emphasis is knowing enough to get started so that we can start to make some changes in the system, and at the same time having a structure in place so I can be gathering real-time data in real time to be able to make adjustments. I have to start to change the system to see how it will react. So our emphasis is on making that change happen.
Alexander has asked, he's phrased it, sometimes the system does not acknowledge the problem as identified by the communities. What then? And I think what he's really getting at there is, how do we define the problem, and who gets to define the problem?
Well, so I think that's a great question in relationship to who has the power in actually selecting the problem that is identified. In our work, our core value is that the problem that is selected needs to matter to the targeted constituents of the solution. So if I'm selecting a problem and it's going to affect families who have children 0 to 5, I better make sure that those very families see this as a problem as well, because if they don't and they don't prioritize it, they will not be engaged in the solution. So we work very hard to help communities identify the power and the importance of leveraging and understanding and making vocal the family's perspective or the targeted constituents' perspective on this problem, and how critical it is to have that guide and drive all of the work. And I would say, I think I mentioned this earlier, that's one of the areas we've been very successful in, is getting the family voice to drive the solution. The problem as well, yes.
Do you think, Pennie, that there's one problem, or that there's multiple problems, and how do you choose which problem in engaging with those communities?
So there are always multiple problems. That's the complexity of this work, right? When we do our problem definition work with communities, which is all on day one of our training, we actually talk to people about having that problems are actually nested, and that we make the distinction between what we call the big P, the big problem that we're organizing our work around. And let's say that that big P is that children are not literacy proficient by 3rd grade. But when we also look at the community, there are lots of little problems, and that's because they're under that problem, they're nested under it, that feed into that. So there are all kinds of other population level problems contributing to the fact that children aren't literacy proficient by 3rd grade. Families are living in poverty. Children are not born healthy, for example, are just two of the reasons why kids aren't literacy proficient by 3rd grade. And so we help communities recognize that by creating a problem framework that articulates that big P, as well as those smaller P's, it's a fabulous way to engage different perspectives and stakeholders and sectors in the work, because they actually see how their work connects to that larger framework. And we have, this is also, that big P, little p framework is language that lots of our communities and states adopt, because it helps them to understand, well, if I'm a healthcare provider and I work with newborns, how is that connected to literacy at all? And it helps them see that work. So that healthcare worker can now see why they're part of the literacy initiative, which they couldn't before.
Excellent. So we'll just do one last question before moving on to the next habit. And Joe asks about, what if engagement with the target population is not happening, and not for lack of trying, but because no one knows how to engage with them?
Yeah, so one of the things that we work very hard on is to identify within communities that who that population trusts. So who are those natural people within the community that my targeted population might trust? It is often not us, particularly if it is a highly vulnerable population that has not been treated fairly well by the local community. And often, for example, in the United States, who we often end up going to because the community has failed to reach out and connect with those individuals is the faith system. And so we might, for example, hold our focus groups in the basement of a church on Sunday right after service, and we have the faith-based minister or reverend announce how important participating in this conversation is. We might actually have hairdressers and beauticians and talk to the people in their room that they're providing services to and ask them to fill out the survey that the researcher has at the end of the hall after they pay their bill. We'll go to laundromats, where families and children go a lot, in the United States at least. And so we go to natural settings, and we leverage natural sources of support to provide the research, the contact. And honestly, we have found that to be very successful in the work. Okay, so I'm now going to actually move into another part of making the work about the system, and that's making the work about the system when we're actually designing solutions and taking action. And so remember I said that we need to make the work about the system across all phases of the work. And just because you do a system scan, just because you identify local conditions that need to be targeted for change, doesn't mean that you're actually going to pursue systems change. Because there are many ways that we design solutions that are still very programmatic in nature. That systems changes are actually designed to disrupt the status quo. So we actually train our communities in disruptive thinking. We don't have time for me to do that with you today, but I encourage you to look at disruptive thinking work in case you haven't done that. But we also introduce them and remind them of how the tobacco industry, at least in the United States, the public health campaign against smoking is one of the most successful public health campaigns of ever in the United States. They significantly reduced the number of youth and adults smoking. And when you look at what they did over the various years to make that happen, they actually did things that targeted, we call this our cloverleaf, the 6 system characteristics. They did things to shift mindsets by having a social marketing campaign. They shifted policies and regulations across all kinds of settings. They shifted connections by shifting referral networks. They created trained providers in how to talk to their families and adults in their practice about the fear of smoking. They shifted the smoking and tobacco programs that were available in communities to make them more culturally competent, for example. And so what the lesson is from this approach is that powerful strategies can actually change the system when they do 3 things. They target root causes, which are these system characteristics. They create reinforcing actions across the community, so the message about why this is important to do comes everywhere you go, and they make it easy to do. So let's just talk about that for a little bit. One of the tools that you will have access to is our guide to powerful strategy resources. We've been reviewing the literature for decades, looking for successful and innovative strategy ideas for addressing the different system characteristics. We have a very long document that you will have access to that will describe some example strategies that you could consider if they connect with your root causes and the system characteristic. That's one of the tools that you'll have access to. But remember, it's not just targeting those root causes, but creating within your community ways to reinforce that action in the support that you want. And the way that I like to think about this is if you've ever been to a rock concert and they throw that ball up in the air, what happens when you throw that ball up in the air? People put their arms up and they start to look for that ball coming to them. Know that when it comes to them, boom, it's their job to hit that ball. That is exactly what you want to be creating in your community. You want to be creating a community where all the different sectors, all the different actors who interface with your targeted population is and how they keep that ball in the air, so they're reinforcing the messages and the goals and the strategies that you care about. What I'd like to do is share with you one video that I think is a brilliant example of a reinforcing action in a community that's focusing on reducing the 3 million word gap and ensuring that all kids are literacy proficient.
We're going to present them with a special kit that has been given to us by the Kaiser Foundation. It includes a onesie, and a blanket. And here's what's cool about this. The onesie and blanket and all the other materials actually have these prompts that just remind you that when you're bathing your child or when you're feeding your child, rather than doing what's kind of easy to do and just bathe them and feed them without any verbal cues, let's talk to her. Let's sing. Let's read a book. And this is just how, and I want you to repeat after me. For the well-being of my child, I promise today to read to her every day, to talk to her every day, and to sing to her every day. Can you sing, Jason? Oh. Do the best you can. This I promise in Jesus' name. God bless you. There's a little kid to remind you of this good work.
Okay, so I love that video because to me it provides a brilliant example of how natural supports and settings within a community can be used to reinforce the messages so that wherever families, children, and youth go, they're getting the same message about the importance of whatever the goal, the behavioral changes that you want. That's what it means to shift a system. You're creating a culture within your community that is valuing what you care about. And so I want to share one example from the field that shows how would you design some powerful strategies. So in several states across the United States, they've received money from the feds to improve and shift home visiting services and to expand them. And those home visiting services are being offered in some of the poorest communities across America. And lo and behold, what did they find? This is a similar story you're going to hear, is that they increased those home visiting slots a lot in those poor communities. And despite the need for them and the demand by the providers that those home visiting slots get offered, lots of them remained empty. And so in one state, they used our system scan approach to identify why, what is happening here in our community and in our state. Why are we able to fill those slots? So what did they learn? Well, home visiting providers were only visiting those teen moms. This was one community that focused on low-income teen moms who are still in high school. They were only visiting them during work and school hours. That teen mom isn't at home during school, is she? Those outreach workers that were going out knocking door to door looking for people to participate were mostly white. This was being done in primarily African American and Hispanic communities. The protocols that were being operated actually aligned with community norms and how work was done and how relationships happened. The nonprofits had no mechanism in place to track if they were filling the slots, and in fact, most of them didn't realize they weren't filling the slots until 18 months after they launched. And nobody was asking the parents, those teen parents, what kind of ways to do the programs. And some of them didn't see any value in this, and so even though they had heard about it, even though they could participate, they saw no reason to participate. So using this data, here are some example strategies they used. They identified in these communities who did these teens trust, and they provided those individuals with training to get the word out. They located the home visiting services in schools themselves and in work sites where those teens were working, so they didn't have to do it at home during those same hours. They also hired neighborhood and faith-based leaders to go out and do the outreach to help do the recruitment. And they trained the nonprofits in how to use action learning techniques to ensure that they were collecting data in real time to fill openings when they emerged. So here's an example of how they both created reinforcing messages, but they also identified strategies to target the root causes. So just to recap, higher performing initiatives tackle multiple root causes. They use powerful strategies to target those root causes and create an aligned community with reinforcing messages. And they build that reinforcing culture. So it is not just what the professionals say, but what the others in the community that I value and trust and see day to day are saying as well. So around habit 2, do we have any questions around designing the solution that we might want to have people have us talk about here? And I think my facilitator is going to ask me these questions.
We'll just wait for those to come through as people type them up. Maybe I'll just put one question out there for you, Pennie, is that I think in my experience, people often get stuck on the word system. And so we've talked a little bit about system boundaries and that can change, and the problem that we choose to work with kind of shifts and change how we think about the system. And I'm just wondering, is there a way that, have you kind of got your elevator pitch about how to help share that concept to somebody, how to describe the system to them?
Mm-hmm. Right, so I think what's really important is to help define what a system is. And so what is a system? It's a set of interacting parts that work together around a shared purpose. And that what you're trying to do is to define what's the purpose that you care about. That's why you're defining that clear problem or that problem framework with the big P and the little p's. And then given that framework, that problem framework, who are the actors and the settings that need to be engaged because they are involved somehow in either living with or affecting or solving that problem.
Yeah.
And so I think what I think we sometimes do is that we have the system and then we're looking for the problem to tackle, when in actuality we have to figure out the problem and the purpose first, and then from that we design our system around that.
Yeah, perfect. Thank you. Mm-hmm. So a couple of questions that have come in. Jill asks, there appears to be overlap with this thinking and collective impact framework. Mm-hmm. Is this on purpose or by emergence?
Yes, so that's a great question. Ironically, our article for the ABLE framework, ABLE was developed separately from collective impact, and we submitted our article for publication at about the same time that the collective impact article was submitted for publication. They just happened to be submitted to the Stanford Social Innovation Review, which publishes much faster than academic journals do. And so they're actually very complementary models. I think it's very, to me, compelling that they are similar in that way. And we actually work in a lot of communities that have adopted collective impact. I think given time, I'm going to move on to the next part of this because I want to make sure we can get through the other pieces.
Yep.
So one of the things that happens in communities is that as you start to do your system scan and think about what your problem is, people start to feel a little overwhelmed. They say to themselves, gosh, this is a big set of things that we have to tackle. And that is why one of our core habits is to help people recognize that what you want to be doing is incubate change. And you do that in a couple of core ways. You help people realize that the way you move that big boulder is by chipping away at it so that you can actually start to shift it. And this really involves leveraging lots of small wins, getting lots of actors in the community, handing them a chisel and having them chip away at that boulder. A small win is something that can be accomplished within 6 months. It creates little resistance. It targets root causes, and it leads to desired changes. So let me give you some examples. In one community we worked in, they had a high amount of high school dropouts. One of the root causes that we discovered was that youth who had been in detention hall, and there were a large number of youth who went to detention, into juvenile detention. While they were there, they took high school courses, but when they came back to the traditional high school, those courses that they took actually got lost and they never got the credits, which then those kids would say, forget it, and I'm going to drop out. And so in one community we worked in, they tackled and tried to understand what's going on here, and what they simply discovered was that it was just course naming. It was the same textbook and course, but in the juvenile detention center it was called Biology A, and in the high school it was called Biology 101, and the computer system had no way to note that they were the same classes. So the social worker from the probation system and the social worker from the school system came together, renamed the courses, and lo and behold, kids start to get credit and fewer kids were dropping out of high school. Here's another example. Same problem, youth with social emotional problems, and they were being removed from their homes and placed in foster care. One of the root causes was that those families were not getting access to mental health services. When we talked to the families about why they weren't accessing the services, the number one reason why was that the intake process was 5 steps long, and it was just too much work. They gave up. So we worked with the community mental health system, got that 5-step process down to 2, and lo and behold, we got so many people in the door that we actually flooded the system with too many families and youth who needed services. So small wins can actually lead to big changes. One of the things that we do in communities is we have them track those small wins. We track them around their system targets or issues, and they use this as both a document to celebrate their successes, but also as a way to track where else they need to put their work. Note in this community that in February '09, we did a strategic planning in November of '09, we did a strategic planning session. They looked at the chart as it was at that point, and they identified that the green line, which was having an array of community-based care, an expanded array, was pretty flat. They decided to make that a priority, and note how the small wins around that grew after that point. This was a community that was known across the state for having no action. We were told to avoid this community because they would not take action. They never do. And within 6 months of using the small wins model, 81 significant changes happened in that county. How do we do this? Again, using that shared agenda, using the data from the system scan, we simply ask critical questions around an action learning framework. So for example, one of the goals that emerged from the system scan in this agenda was that they wanted to have a more coordinated system and actual referrals that worked across agencies. We asked them in a meeting of providers to identify, well, why are referrals not working and why is that happening? We did a root cause analysis in the meeting. And given the problems that were identified, what can be done about this that can be achieved within the next 3 to 6 months? They identified that one of the biggest burdens was a lack of a shared consent form, so they didn't know what information they could share, which led to referrals not working. In 6 months, we had a consent form that was adopted by 30 plus organizations across this county. There is a guide that you will also receive from us. It's called our Small Wins Guide, and we went through all the different stages of the work and identified all the different kinds of small wins that you might consider populating and helping to make happen within your community. You will get access to this after the webinar. Another way to do small wins, and we call these small wins on steroids, is to adopt the idea of the 100-day challenge, which has been very popular in the business sector. And in a couple of communities recently, this has been very successful for us. These were communities that were stagnant and were not able to move to action. So we launched an official 100-day challenge. And what is that? It's a project that's focused on action learning, that you're trying to make a tangible, concrete difference and have it succeed in 100 days. And so we've had hundreds of people join, self-organize around challenges that they are going to use in response to the system scan data. So for example, in one community within 8 weeks, they launched a summer reading program. They got books to over 300 kids because this was a school community where there was very low access to books in the low-income neighborhood. So just to sort of wrap this up, one of the things I want you to note is that higher performing community initiatives activate lots of change actions, and they trigger small wins that target root causes. Okay, so the last habit. One of the challenges that happens is that whenever we start to collect data, we begin to feel like oh gosh, we have a plan, now we know where we're headed, and this is what it's going to be like, and in reality, the world is like this. So we need to help organizations and communities create spaces that help them recognize that this is their reality. And so that means that we need to help them know how they can adapt quickly. Unfortunately, the way that we've organized our partnerships and communities, by partnerships I mean sort of the collaborative settings we bring stakeholders together around, do not do that. And that's because there's too many people at the table, so people aren't listening, or they're multitasking and doing something else. And so kind of like the collective impact structure, what we have done is we also self-organize people into other tables, multiple tables, and we have people self-organize around affinity groups that help them identify and be in a safe, authentic space where they can learn with other people who are in a similar space and doing similar work. So what are some examples of this? In one community, the community we started with in Saginaw, the action learning structure they created was we had a team of leaders. These were the top CEOs and executive directors. We had another team with the service providers. We had a family team, and we had a youth team. They all worked on the same agenda that was driven by the system scan that we did with them, but each team acted on that agenda in a different way depending upon the role that they played within the community. When I said this was the community that had the 81 actions happen, those actions came from all 4 teams. Other communities organize themselves more around strategies. So in another community, we have a healthy babies team, we have an engaged parents team, a quality pre-K team, a developmental screenings team. In other communities, they organize themselves around their systems issues. As maybe they'll have a coordination team, an alignment team. What I'm trying to get across is that it's less about the structure and it's more about what is the best way to bring people together in a safe space where they are willing to talk about the real problems they're facing day to day and be willing to motivate and move to action. The idea is to help everybody recognize that they can be a collective actor and an agent of change. The other way that our structures impede action is that our agendas are what some people in our South call a sit and get. In that all people do is come, they provide information, others provide information, and then they go home. My view about meetings like that is that we have something else much more useful for sharing information, and that's called the internet. That instead, when people come together collectively, we actually need agendas and meeting processes that can actually move your partnership to action today. And so I already shared with you one way that we do this is we actually design our agenda around promoting action by using an action learning cycle. And then we actually have our meeting minutes that are organized around promoting action. When people volunteer for action, they're listed in the minutes, and then we provide behind-the-scenes support to help them become a winner, get that action implemented as quickly as possible, so that at the next meeting we can give an update on the actions they've taken. I've been mentioning the action learning cycle quite a bit. I just want to highlight a little bit about what that is, and then again you'll get more tools about this post the webinar. But the action learning cycle that we've developed is similar to, if you know the plan, study, do, act cycle. It's something like that, but we renamed it and organized it a little bit differently to support systems concepts. First, you have to define the problem and understand what it is. You have to design a solution. You have to do work effectively and track your implementation. And then you need to learn and maybe redefine your problem if you need to. We train communities in action learning, both in terms of what it is and what it looks like, but also how to facilitate it, and more importantly, how to weave action learning information across all of the groups within your community. And what I want to do is share with you one example about why that weaving is so critical. So let's go back to Saginaw. I like to pick on them a lot. And here's an example. This is the community that developed the shared consent form. About a month after the shared consent form was up and running, we asked the leaders team, how's the shared consent form working? And every single leader in the room said, great. Well, just happens that later that day, we were meeting with the direct service providers, all of whom were representatives from those same organizations. We asked them, how's that consent form working? The number one answer we got was, I didn't know we could use it. We go back to the leaders and we say, it seems that not all of the providers are aware they could use the shared consent form. And what do you know? We finally get an honest answer. Several of the leaders said, oh, I forgot to get our lawyer to approve it. So note how critical that feedback loop in real time was necessary. If all we had done was ask the leaders, we would have thought that consent form was in action. Same thing, we go back to the providers a couple of months later. They tell us it's working. We go to the families and they ask us what shared consent form, okay? And what we discovered was that it was only the providers that were coming to our meetings that were using it, not all of the providers in each organization. So we had to design and implement a cross-agency training for all providers to get it implemented widely. So this is what action learning looks like. You are asking and checking up on implementation. You're gathering input from multiple sectors and stakeholders and perspectives to understand what implementation really looks like. You're providing feedback and revising as you go. So, just to wrap up, high-performing community change initiatives identify emerging issues and opportunities. They make meetings about real-time problem-solving, action, and learning. And they build and leverage feedback loops. And so what I'd like you to do is I'm going to turn this over to my facilitator, and she's going to see what questions you might have around Habit 3, incubating change, or Habit 4, adapting quickly. You can type those in, and if there's any other questions that have come in, you can feel like you can certainly raise those as well.
So while people are typing in, I'd just like to come back to one from the last section, and it talked about, there was a couple of points that referred basically to how do we bring somebody into this process who doesn't identify or realize that they are part of the system.
Mm-hmm. Yep. So I actually think that what is really important is to engage them in the system scan process and to ask them the questions in the system scan. And what we've discovered is that engaging them around questions around those kinds of issues helps them to see how they can become part of the solution and why they need to be at the table. We also engage people in community visioning processes. We use a visioning process as a way to launch stakeholder engagement, in which we bring lots of people into the room. We ask them to envision what they want their future to look like. We use the TOP method, the Technology of Participation method, that comes out of the Institute of Cultural Affairs in Chicago. It's a method that's been used around the world. We use that method, and we have found that to be very effective when people are worried that stakeholders won't join the effort. A visioning effort is a great way to launch it.
Excellent. Thanks so much. So we don't have any questions regarding this habit just yet, but Karina has asked if you can just refer again, what method is she talking about? I think is the second tool she's asking. Is that the visioning tool? We're not sure exactly.
I don't know which tool, which method she.
Yes, she said yes. So I think it's the visioning tool.
Yes, the visioning tool. Yes, and in fact, on our website, I'll make sure that I include this in our guide for you. We have a whole set of actual visioning agendas and processes to help guide you in creating a visioning process. So we really try to make that stuff available to everybody in the community and around the world. And so you can go on our website and find a whole set of agendas and examples from other communities that have designed visioning sessions. And that's become a method we've increasingly used as a great way to get people oriented. And in fact, as part of our visioning session in a day and a half, we can have not only stakeholders identify the vision of where they want to go, but we actually then do a system scan in the meeting where they identify the system conditions that are getting in the way of that vision today. And so now we have the system scan data, and then they use that to design their powerful strategies.
Wonderful. Thank you. And I'll just go back to one of the other questions because I think it's quite useful as well. And someone asked, where do you look for the interrelationships in the system so you can see where the best leverage points are? Mm-hmm. Where do you do this within your process?
Mm-hmm. That's a fabulous point. So what we know, right, from a systems thinking perspective is what you're ultimately looking for are those patterns that are actually under all of these sort of system things that are occurring, and it's those patterns that you're trying to leverage. So one of the most powerful ways that occurs in our work is in our sense-making process. So people go out and collect the system scan data, and we actually engage them in making sense of it. And we use Hallie Praskill's concept of creating a candy store. And so we have the data typed up on little slips of paper. It's printed out, cut up, and people then sort it like they're sorting candy into a bins. And in the process of that sorting, you begin to see patterns that are emerging because issues are coming up that are cross-sector, cross-perspective, and you're beginning to see relationships across the different kinds of data. And I will say that one of the most powerful things that happen when we have people do that sorting is you hear people say, oh, I had no idea this was related to that, because they're looking for the relationships across the data points that they found. And so that is then what drives what becomes systems targets for change, is we're looking for those areas of intersection during that sense-making process.
Perfect. So there's just one last question I'd like to address, and then we'll wrap up to keep everyone on time. Andrea has asked, is there work done in your process to identify who collects ongoing data about outcomes, improvements needed, and how is accountability decided? Mm-hmm.
Right. So yes, America is a very outcome-oriented place, and one of the things that we help communities do is to develop an outcomes framework for their work. both outcomes at the population level, then we identify what are outcomes for early successes for children and families, as well as outcomes at the system level, and we help them identify and adopt evaluation tools to track that information. For me, accountability is mutual, and that is something that we really emphasize, that this is something that should be owned by everybody in the community. Everybody is an actor of change, and everybody is an owner of the change. And so, so that's a really important motto of our work.
Wonderful. Well, I'd just like to say thank you so much to Professor Foster-Fishman for delivering this webinar this afternoon. She's a professor in the Department of Psychology at the Michigan State University. She's a co-creator of the Able Change framework, and she's joined us here in Sydney. As we mentioned, we have recorded this session. We will make this recording available, as well as the documents that Pennie has referred to throughout this afternoon. We thank you all so much for your participation. And what I'd also greatly appreciate, as someone from the TAP side of things, is that we've got an evaluation, and it's just a handful of questions, and if you could take just a few minutes to complete that evaluation, we'd be grateful to get some feedback on how you found this session and in use for your own work and that sort of thing. So thank you again, everyone, for your time, and we look forward to seeing you soon in another webinar.
Thank you.